Presentation is evaluation of ocular surface disease and quality of life in glaucoma patients. Glaucoma is a chronic progressive optic neuropathy characterized by typical optic disc changes and retinal nerve fiber layer changes with associated visual field defects. The first line therapy is medical therapy, where anti-glaucoma medications are used, and benzyl alkonium chloride, BAC, is a preservative that contributes to ocular surface disease by causing tear film instability. It has a well-known dose-dependent toxicity. Ocular surface disease index is a 12-item questionnaire which is used for rapid assessment of ocular surface disease. Glaucoma quality of life 15, it is a 15-item questionnaire where the patient can evaluate their ability to perform visually demanding tasks in daily life. The aim of the study is to investigate the relationship between topical anti-glaucoma therapy, ocular surface disease, and quality of life in glaucoma patients. The methodology used was, it was a cross-sectional comparative study from November 2019 to September 2021, and the sample size for the study was 85. The inclusion criteria was, all participants were 40 years or older, and in the control group, patients are glaucoma suspect without any visual field loss. They had a normal intraocular pressure, and they were not on topical therapy. In the case group, they were diagnosed as having primary open-angle glaucoma, and they were on topical anti-glaucoma therapy for at least a period of 3 months. The exclusion criteria was patients with visual field defect due to non-glaucomatous conditions, laser treatment or filtration surgery in the past 3 months, patients with prior ocular surface disease prior to starting glaucoma therapy, patients with secondary glaucoma, angle closure glaucoma, and lid abnormalities such as entropion, ectropion. Assessment was done with best corrected visual acuity using Snellen chart, which was converted to logMAR. Intraocular pressure was measured. Fundus and disc evaluation was done with slit lamp biomicroscopy. HFA 24-2 CETA standard was done. Detailed drug history, considering the number of drugs, the type of the drug, the duration of use, and the number of back drops per day was noted. Ocular surface disease was evaluated using TBUT, Schirmer test 1, corneal staining, and the questionnaire used was OSDI and GQL15. Glaucoma patients were classified according to glaucoma staging system into 3 groups based on the loss of visual field as mild, moderate, and severe. The tear breakup time was normal if it was more than or equal to 10 seconds and severe if it was less than 5 seconds. Corneal fluorescent staining was normal if there were 0 dry spots, mild if there were 1 to 2 dry spots, moderate if there were 3 and 4, severe if it was more than 4 dry spots. Schirmer test was normal if it was more than or equal to 10 millimeters and severe if it was less than 5 millimeters. This was the OSDI questionnaire given. It was 12 questions and the total score is out of 100. It is normal if the score was between 0 to 12, mild 13 to 22, moderate 23 to 32, and severe if the score was more than or equal to 33. Glaucoma quality of life 15, it has 15 questions, the total score was 75, and as the score was higher, it implied that there was a poor quality of life. Coming to the results, the mean age among the participants was 58.6 and the range was 40 to 89. The gender distribution in my study was equal. The distribution of glaucoma patients in my study, 29.1% were from moderate glaucoma. The mean value of TBUT and Schirmer was lower with higher corneal staining values in cases. And distribution of glaucoma patients according to the anti-glaucoma medicine, approximately 50% they were on prostaglandin analogs, followed by beta blockers. Correlation between OSDI and GQL15, there was a high and strong positive correlation between both, suggesting a poorer quality of life. And this was the parameters that was considered in the study. IOP, cup disc ratio, mean deviation all increased as the disease progressed. Duration of use and backdrops per day also was more in severe cases of glaucoma. Ocular surface disease parameters like TBUT, Schirmer decreased with the severity of the disease, and on the contrary, corneal staining increased with the severity of the disease. OSDI and GQL15 scores also increased with severe glaucoma. This was an additional finding where we compared back-free prostaglandin analogs with back prostaglandin analogs, and we found that the parameters like TBUT, Schirmer, they increased, they were more in patients who were using back-free, and this OSDI score was also found to be lower. However, GQL15 score was independent of these factors. Coming to discussion. In my study, the mean scores for mild was 23.3, for moderate 38.3, severe it was 44.4. This was higher compared to the mother study it was done by Skalicki et al. One reason could be that they had more number of mild glaucoma patients, and the GQL score in my study was similar to that found in Skalicki et al. Study. T-Butt-Schirmer test was low and corneal staining was high in severe glaucoma patients. This was similar to the studies conducted by Matthews et al. And Ramley et al. Conclusion. Prevalence of ocular surface disease among glaucoma patients is attributed to multiple drug use and the preservatives. Severe OSDA symptoms were associated with decreased T-Butt-Schirmer and increased corneal staining values. Higher dose of anti-glaucoma drug was associated with poorer quality of life with increased GQL score, and there was a strong positive correlation between OSDI and GQL15. These are my references. Thank you.
You have done Schirmer's yourself, no?
Sir?
You have done the Schirmer test with yourself, you have done?
Yes, sir.
For the patient?
Yes, sir. Yes, sir.
You asked the patient, all the patients to close their eyes or open the eyes, and some other patients
So Schirmer test 1 was done. We keep the, it was done closed, and after 5 minutes we check for the values.
Okay. Thank you.
Okay, what is your recommendation for improving the quality of life of patients who use multiple anti-glaucoma medication?
Madam, we can go for back-free analogs, that is one, and we can use heavy molecular weight, artificial tears can be used, again, which is preservative-free, and this will help in improving the